Hi Cole, my name is Nathan. I'm a student nurse practitioner, and I'm going to be doing a head-to-toe assessment on you. I'm going to be assessing all your body systems. I'm going to be using different equipment to look at your eyes, your ears, your nose, and your throat. If you feel uncomfortable at all through the procedure, just let me know. Do you understand?
Yeah.
Okay, do you consent to the exam?
Yes.
Okay. Alright, so I'm going to wash my hands. Can you tell me your name and your date of birth, please?
Cole Smith. I was born November 12th, 1998.
Okay. So when Cole walked in, his gait was steady, his posture is good, he has good nutrition, he appears his stated age, and he looks in no distress. So to start, Cole, I'm going to get your vitals. Put this on your finger. (118/74). Heart rate is 59. Pulse ox is 98% on room air. Check your temperature. Okay, respirations are 14. Temperature is 99.9. Okay, Cole, can you tell me your full name and date of birth again?
Cole Smith, and my birthday is November 12th, 1998.
Okay. Can you tell me where you are right now?
I'm in a hospital.
Good. What year is it?
2021.
Good. Can you tell me what month it is?
April.
April. Okay. Can you tell me how old you are?
22.
Okay. Can you tell me your telephone number?
740-393-0726.
Okay. Who's the president?
Joe Biden.
Okay, I'm going to give you 3 words to remember. I want you to repeat them now, and then I'll ask you later in the exam. So, apple, dog, baseball.
Apple, dog, baseball.
Good. So, starting at 100, can you count back by 7?
Yeah. 100, 93, 86, 79, 72, 65.
Good. Okay. And then, can you tell me why you're here?
Just for a general wellness trip.
Okay, very good. Okay, so I'm going to give you this. Are you right-handed or left-handed?
Right-handed.
Right-handed, okay. So I'll give you that, and I want you to draw a clock that shows 2:30.
Okay.
So that shows 2:30. Okay. All right, I'm going to start the exam with your cranial nerves. So we're going to do the first one. This is olfactory.
Okay.
So what I'm going to have you do is close your eyes. And I'm going to block your left nostril, and I want you to breathe in through your nose. And tell me what you smell.
Coffee.
Good. Okay. So I'm going to occlude your right nostril and then breathe again through your nose.
Vanilla.
Very good. Okay. So cranial nerve 1 is intact. We're going to go to cranial nerve 2, which is the optic nerve. So what I'm going to have you do actually to start is I'm going to have you stand up for me. And I'm going to have you block your right eye. And I'm going to block my left eye. And I just want you to tell me when, look at my eye with your other eye and tell me when you see my fingers move in your peripheral.
Yep. 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 Yep.
Good. Okay, switch eyes. Okay, same thing. Look right at me.
Yep. 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 Yep.
Good. Okay. All right, I'll have you sit down. So I'm going to use the Snell chart, and I'm going to hold it about 14 inches away, and I want you to read the lowest number you can with both your eyes first.
LTFPH.
Good. Now can you block your right eye?
LTFPH.
Good. Can you block your right eye?
LTFPH.
Okay, good. Skull has 20/20 vision in both eyes. So I'm going to have you pull up your glasses for a second. I'm going to use an ophthalmoscope and I'm going to look at your eyes. I'm going to look at your pupils first. Okay, so pupils are equal, round, reactive to light. I want you to look at the wall and then look at my finger. Good. Okay, so pupils are equal, round, reactive to light, and accommodation. So I'm going to look closer with the ophthalmoscope. Okay, I'm going to look directly into your eye. So the red reflex is intact. You can see the optic disc and the macula. There's no hemorrhages, exudate, or cotton wool patches. Okay, I'll do the same thing on the other side. So you can see the red reflex. See the optic disc. You can see the macula. There's no hemorrhages, exudate, or cotton wool patches. Okay, so cranial nerve 2 is intact. So we're going to move on to cranial nerve. You can put your glasses back on. We'll move to cranial nerve 3, 4, and 6. So the ocular motor, the trochlear, and the abducens. So I'm going to have you look, keep your head straight, and just follow my finger, okay? Okay, so extraocular movement is intact, so cranial nerve 3, 4, and 6 are intact. So we're going to go to cranial nerve 5, the trigeminal. So what I'm going to have you do is open your mouth. I want you to bite down on that so I can feel the masseter muscle and the temporalis. Good. Okay, and then I'm going to palpate, so it should be equal sensation on both sides. Does it feel the same?
Yeah.
Okay. So cranial nerve 5 is intact, so we'll go to cranial nerve 7, facial. So I want you to smile for me. Can you puff out your cheeks? Good. Can you squeeze your eyes really tight? Okay, can you raise your eyebrows? Good. Okay, cranial nerve 7 is intact. Cranial nerve 8, vestibular cochlear. So I'm going to occlude your right ear. I'm going to whisper a word, okay? Just tell me what word I say.
Hockey.
Good. Okay, I'm going to do the same thing over here.
Bowling.
Good. Okay, so cranial nerve 8 is intact. I'm going to assess cranial nerve 9 and 10. So to do this is the glossopharyngeal and the vagus. So what I'm going to have you do is just open your mouth for me and say ah. Okay, so the uvula elevates. Good. Okay, I'm going to have you swallow for me. Okay, good. So when he swallowed, the thyroid raised with swallowing. The thyroid's not enlarged. Trachea is midline. There's no goiter. The thyroid's not enlarged. Can you cough for me? Good. Okay, and then I'm going to assess your gag reflex here. So a little uncomfortable. Okay. So cranial nerve 9 and 10 are intact. I'm going to go to cranial nerve 11, the accessory muscles, accessory nerve. So raise your shoulders. Good. Push your head against resistance. Good. And the other side. Good. So cranial nerve 11 is intact. Cranial nerve 12, the hypoglossal. Can you stick out your tongue? Can you raise it up and down and left and right? Good. Okay, cranial nerve 12 is intact. So cranial nerves 1 through 12 are all intact. Okay, so I'm going to, looking at your head is symmetric. There's no visible masses or lesions that I see. I'm going to palpate your head now. Hair distribution is good, and I don't palpate any masses or lumps on his head. I'm going to check TMJ, so can you open your jaw for me? Good, one more time. Okay, any pain or tenderness with that?
No.
No, good. All right, I'm also going to palpate your sinuses, so your maxillary. Is there any pain or tenderness with that?
No.
Okay, your ethmoid. Any pain or tenderness with that?
No.
Okay, frontal. Any pain or tenderness with that?
No.
Okay, none of those areas are tender or enlarged. Okay, and then I'm also going to check your lymph nodes. So I'm going to go with the pre-auricular. I'll go post-auricular. Occipital. Are there any tender in any of those spots so far?
No.
Okay, I haven't been able to palpate any of those spots. Okay, tonsillier. I can't palpate. Is it tender?
No.
Okay. Submental, not palpable, any pain?
No.
Submaxillary, not palpable, is there any pain?
No.
Good. Okay, anterior cervical, it's not palpable, is there any pain?
No.
No. Posterior cervical, not palpable, is there any pain?
No.
Deep cervical, it's not palpable, is there any pain?
No.
No, good. Okay, supraclavicular, it's not palpable, is there any pain?
No.
Okay, inferior clavicular, not palpable, is there any pain?
No.
Good. Okay, you can put your glasses back on. Now, do you remember those 3 words I asked you earlier?
Yeah. Apple, dog, baseball.
Okay, very good. Okay, so I'm going to examine your ears now. So I'm going to look externally at your ear. So there's no redness or inflammation, there's no drainage. I'm going to pull your ear up and out. Is there any pain with that?
No.
Okay. With the otoscope, I'm going to examine your inner ear. So the tympanic membrane is pearly gray. There's no inflammation, there's no redness. The ear canal is patent. All right, again, looking at the external ear, there's no redness or inflammation, there's no drainage. I'm gonna pull up and out again. Is there any pain with that?
No.
Okay. Again, with the otoscope, I'll look in your ear. Tympanic membrane is pearly gray. There's no redness or inflammation. There's no drainage, and the ear canal is patent. All right, I'm going to do the Weber test. So tell me if you can hear this equally on both sides, okay? I'm going to put this on your forehead.
Yeah.
Okay, good. So now we're going to do the Rene test. So I'm going to put this on your mastoid. Tell me if you can hear it, and tell me when it stops. Can you hear it?
Yeah.
Okay, tell me when it stops.
No.
Okay, can you hear it?
Yeah.
Good. Same thing on the other side. Can you hear it?
Yeah.
All right, tell me when it stops.
No. Yeah.
Okay, good. So he has positive Rene on both sides and a normal Weber. So I'm going to look at your eyes externally. I already looked at them with the ophthalmoscope. So looking externally,
Yeah.
looking externally, the sclera are white, conjunctiva is pink, there's no ciliary flush, there's no drainage, there's no nystagmus with the eyes. Good. All right, now looking at your nose, the nose is midline, there's no redness or inflammation or edema, and there's no drainage. So I'm gonna have you lean your head back for me. I'm gonna examine with the otoscope again. This is a different probe cover. Okay. So his tissue is intact, turbinates are not inflamed, not enlarged, there's no drainage, the septum is not deviated. We'll do the same thing over here. Okay, tissue is intact, turbinates are not inflamed, not enlarged, there's no drainage, and the septum is not deviated. So now I'm going to look at your mouth. So externally looking at your mouth, there's no lesions. The skin's intact, there's no drainage. I'm going to have you open your mouth for me. So looking inside his mouth, the buccal space and mucosa are pink, moist, and intact. He's got good dentition, he's not missing any teeth. Can you say ah for me? Okay, good. So the pharynx is pink and intact. His tonsils are pink and intact, not enlarged or inflamed. Okay, you can put your glasses back on now. Okay, so I'm going to palpate your carotid. 2+ on the left, 2+ on the right. All right, I'm gonna auscultate. I just want you to take a normal breath and then hold your breath for a second, okay? Okay, good. Same thing on this side. Okay. So no brutes noted, which is good. Looking at his chest is symmetric. The skin over his chest and abdomen is intact. There's no lesions, there's no bruising, there's no ulcers. His skin is appropriate for ethnicity. It is warm. Okay, so I'm gonna auscultate your heart in several different spots here, okay? So you can just breathe normal for me. So over the aorta, hear S1 and S2, I don't hear S3, S4, or any murmurs. Over the pulmonic. Okay, S1 and S2, I don't hear S3, S4, or any murmurs. Over the tricuspid. Okay, I hear S1, S2, I don't hear S3 or S4, and any murmurs. In the mitral. Okay, S1 and S2, I don't hear S3, S4, or any murmurs. I'm going to do the same thing with the bell, so over the aorta. Okay, S1 and S2, I don't hear S3, S4, or any murmurs. Over the pulmonic. Okay, S1 and S2, I don't hear S3, S4, or any murmurs. Tricuspid. S1 and S2, I don't hear S3 or S4, or any murmurs. And then over the mitral. Okay, I hear S1 and S2, I don't hear S3, S4, or any murmurs. All right, I'm going to locate the angle of Louis. Okay, I'm going to move mid-clavicular, and I'm going to move down 3 intercostal spaces. Okay, so the PMI, 5th intercostal space, mid-clavicular line. I don't feel any thrills, heaves, or lifts, which is good. I'm going to have you lay back on these pillows. Okay. So with the head at 30 degrees, I'm going to have you turn your head to the right for me. I'm going to look for JVD. So looking at his neck, there's no JVD. Have you turn the other way for me, Cole? Okay. Again, looking at his neck, there's no JVD, which is good. Okay, you can sit back up. Okay, so Cole's respiratory effort is normal, it's regular. His chest rise is symmetric. Looking at his anterior, posterior to transverse ratio is 1 to 2, which is normal. I'm going to auscultate over your trachea first here. Just take a normal breath for me. Okay, good. So there's no stridor over your trachea, which is good. All right, I'm gonna listen to your heart anteriorly. Okay. I want you to take deep breaths for me. Okay, good. Okay, so lungs are clear bilaterally. There's no crackles, wheezing, or rhonchi. I'm going to now percuss, so you're gonna feel a little bit of pressure. I'm gonna be striking my fingers, okay? Okay, so resonance to percussion anteriorly. I'm gonna have you turn around for me. All right, so we're gonna do the same thing, Cole, here with the lungs. So I'm gonna listen here posteriorly, so I'll have you take a deep breath. Okay, so lungs are cleared posteriorly. There's no crackles, wheezing, or rhonchi. I'm gonna check for egophony, so I'm gonna have you say E every time you hear my stethoscope move, okay? E, 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 E. Okay. So negative for egophony. I'm going to check for tactile fremitus. So I want you to say 99 every time I move my hand, okay?
99, 99, 99, 99, 99.
Okay. So negative for tactile fremitus as well. So you can flip back around for me and you can actually lay down. Okay. So can you move your hands to the side for me? Okay. So looking at Cole's abdomen, the contour is normal. There's no ascites, there's no pulsating masses, and there's no visible peristalsis. So I'm going to auscultate your abdomen. So you can just breathe normal for me. So we got normal active vowel sounds in the right upper quadrant. Normal active vowel sounds in the left upper quadrant. Normal active vowel sounds in the right lower quadrant. Normal active vowel sounds in the left lower quadrant. I'm going to listen with the bell, same thing. Normal active vowel sounds in the right upper quadrant. Normal active vowel sounds in the left upper quadrant. Normal active vowel sounds in the right lower quadrant. And normal active vowel sounds in the left lower quadrant. I'm going to listen for bruise over a couple different spots, okay? Starting at your aorta. Okay, no bruise over the renal artery. Okay, no bruise over the iliac arteries. No bruise, and then over the femoral. Okay. No bruise. Okay, so I'm going to percuss your abdomen. So you're gonna feel a little bit of pressure, okay? Okay, so we got tympanic resonance, which is normal. So I'm gonna lightly palpate your stomach, okay? Tell me if there's any tenderness anywhere. Any tenderness anywhere?
No.
Okay. I'm going to deeply palpate, feeling for masses. Okay, no masses. Okay, so now I'm going to palpate your liver. So I want you to take a deep breath for me. Okay, you can palpate the liver edge. Okay, I'm going to palpate your kidneys. So again, take a deep breath for me. Okay, I'm unable to palpate the right kidney. I'm going to try and palpate your spleen. Can you take a deep breath for me? Okay, I'm not able to palpate the spleen. I'm going to try and palpate your left kidney. Deep breath. Okay, I can't palpate the left kidney either. Okay, cool. I'm going to have you sit on the edge here and turn around for me. Okay, I'm going to check costovertebral angle tenderness here. So I'm going to strike my hand, okay? Tell me if there's any pain or pressure.
No.
No? Okay. I'm going to do it on the right side. Any pain or tenderness?
Yeah, on that side.
Okay, what's it feel like? How can you describe the pain?
It was a sharp pain.
Sharp pain, okay. From like 0 to 10, what would you say?
Like 5.
5. Okay. And while you're sitting here, I'm going to percuss your lungs here. Okay, lung percussion is resonance on posterior, which is good. Okay, I'm going to check. I'm gonna have you look straight ahead. I'm gonna have you bend your neck down for me. Okay, so there's T1 and there's C7. Okay, you can put your head back up in normal position. I'm gonna check spinal alignment. Okay, so spinal alignment is normal. There's no kyphosis and there's no scoliosis. I'm going to palpate the paraspinal muscle, so tell me if there's any pain or tenderness anywhere. Okay, in the cervical area. Any pain or tenderness?
No.
Okay, in the thoracic, is there any pain or tenderness?
No.
Okay, in the lumbar, is there any pain or tenderness?
No.
Good. Okay, I'm going to have you stand up for me. All right, and I'm going to have you bend down like you're touching your toes. Good, extend back. Okay, Moving laterally to the left, laterally to the right. Good. Can you rotate? Good. Okay. Can you look up? Look down? Okay. Look left, look right. Touch your left ear to your left shoulder, right ear to your right shoulder. Good. Okay. And we're going to do the wrong bird test while you're sitting here. So can you put your feet together for me? Okay. And put your hands out, palm side up. There you go. And I want you to close your eyes. We'll see if we can do this for about 30 seconds. Okay. All right. All right, you can come back and we'll sit down. Okay, so we'll go to your upper extremities to start. So I'm going to check your pulses to begin. So your right brachial is 2+. Your right radial is 2+. Your left brachial is 2+. Left radial is 2+. So looking at his fingers, there's no clubbing or cyanosis. Cap refill is less than 3 seconds bilaterally. I'm going to assess sensation. So I'm going to have you close your eyes and you just tell me sharp or dull.
Okay. Sharp, dull, 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 sharp, sharp.
Good. Okay. I'm going to test your reflexes, starting with your tricep. Good. Bicep. Okay. Brachioradialis. Good. Okay, we'll do the same thing over here. Okay, tricep. Good. Bicep. Okay, good. Brachioradialis. Good. Okay, so reflexes are 2+ on the upper extremities. All right, cool. We're going to do passive range of motion to start. So I'm going to take your hand. So I'm going to flex and extend your fingers. Extend. I'm going to flex and extend your wrist. I'm going to flex and extend your elbow. I'm going to raise your arm. Any pain with those movements?
No.
Okay. Okay, we'll do the same thing over here. So we'll flex and extend. Flex and extend. Flex and extend the wrist. Flex and extend the elbow. And raise, shoulder. Any pain with that?
No.
Okay. All right, so now can you do those same movements for me? So we'll do active range of motion now. So flex and extend your fingers, good. Flex and extend your wrist. Flex and extend your arm. And raise your shoulder. Other way. Oh, there you go, good. We'll do the same thing on the other side. So flex, extend, there you go. Flex, extend, raise your shoulder, yep. And then, yep, very good. Okay, so he's got full range of motion. So we're gonna test strength. So I'm gonna have you squeeze my fingers to start. Okay, I'm gonna have you with your fingers, kind of put your hands like this for a second. Okay, press down with your fingers there. Pull back with your fingers, good. Okay, with your wrist, press back against me. There you go, press down, good. I want you to flex your arm. There you go, extend out, good. Push against me, pull in, good. Okay, we'll do the same thing over here again. So push down, pull against, good. With your wrist, press down, good. Pull against with your wrist, good. With your arm, bicep, pull, okay. Push against me, pull against me, good. Okay, so his strength is 5 on his upper extremities. We're gonna do the pronator test as well. So it's kind of the same thing, like sort of like the wrong bird. So stick your hands out, palm side up, with your eyes closed again, straight out, palm side up for me. There you go. And just keep your eyes closed for a second. Okay, good. Okay, so we're gonna move on to the lower extremities now. So I'm going to check your pulses. So pedal pulse on the left is 2+. Posterior tibial is 2 plus. Pedal pulse on the right is 2 plus. Posterior tibial is 2 plus. So looking at his legs, there's no varicose veins that I can see, and there's no edema. His toes, cap refill is less than 3 seconds. There's no clubbing or cyanosis on his toes. I'm gonna have you close your eyes for me, and again, we're gonna do sensation, so just tell me sharp or dull.
Sharp, sharp, dull, dull, sharp, sharp.
Okay, very good. Okay, so I'm going to test your reflexes while we're here too. So your plantar reflex, good, good. Okay, your Achilles, kind of flex your foot a little bit, good. Okay, so reflexes are 2 plus on the lower extremities. All right, I'm going to have you lay back for me. So we're going to do passive range of motion and active range of motion again. So with your toes, we're going to do passive range of motion first. So extending and flexing, flexing, extending, okay, flexing, extending. I'm going to internally rotate the hip, externally rotate the hip, okay, and we're going to abduct and then adduct. Good. So we're going to do the same thing over here with the left. So we're going to flex the toes, extend the toes, flex the ankle, extend. I'm going to flex the knee, extend the knee. I'm going to internally rotate the hip, externally rotate the hip. I'm going to abduct and adduct. Good. Okay. Now can you do those movements as well? So active range of motion now. Toes, yep. Flex and extend. Ankle, extend, flex. Knee, flex, extend. All right, can you internally rotate? There you go, externally rotate. Good. All right, now can you abduct and then adduct? Good. All right, we'll do the same thing with this one. So toes, flex and extend. Ankles, flex, extend. Knee, flex, extend. All right, can you internally rotate, externally rotate? Good. Can you abduct, adduct? Good. Okay, so he's got full range of motion in his lower extremities as well as his upper extremities. I'm gonna have, actually, we'll stay there for 1 second. So I'll have you press down like a gas pedal, pull up toward your toes, to your nose. There you go. Okay, and while you're here, we're going to check, I'm gonna check vibratory sense. So just tell me when you stop feeling this vibrate, okay?
Okay. No.
Okay, and that's the same for me, so we'll do it again on the other toe.
No.
Okay, and that's the same for me, so that's normal. I'm going to test your plantar reflex. So, okay. Good. Good. Okay, so negative Babinski. We'll stay down here for just a second. All right, so I want you to close your eyes. We're going to test position sense of your toes. So tell me if you're going up, if I'm moving your toe up or down, okay?
Down, up, up,
Good. We'll do the other toe.
down, down, up.
Okay, very good. Normal position sense. All right, I'm going to have you come to the edge again for me. Okay, so we're going to test strength. So we did your plantar, so I'm going to have you push, kick your legs out, pull in. Good. Okay, push your knees together, press apart. Good. Okay, so his strength is 5 plus and his lower extremities as well. We're going to do the coordination. I'm going to test your coordination. So with your right hand, I want you to touch my finger and then touch your nose.
Okay.
Good, and then switch hands for me. Good. Okay. With your hands, I want you to pronate and supinate on your lap rapidly for me. Good. And then I want you to do heel to shin. So with your right foot, touch your left shin, then alternate. Yep. Very good. Okay, good. Okay. So one health recommendation for you, you do have extensive family history for heart disease. So what I would recommend is eating a healthy diet and exercising regularly, and that should help combat that.
Okay.
Okay. Do you have any questions for me?
No.
Okay. So I'm going to wash my hands. And thank you for letting me assess you. All right. Have a good day.
You too.